24-hour surveillance and screening for all people entering the county. We encourage people not to panic, but take the directed precautionary measures. We don't want anybody to panic. We have just be serious about ensuring that we take those measures seriously.
Hivyo basi, kuna haja ya kuweka usalama wa kutosha. Wakati huo Gavana Awiti alipiga marufuku mikutano katika kaunti hiyo na kuelezea kuwa mikutano ya hadhara inayozidi watu 15 ni hatari.
This includes harambes, faith-based gathering, funerals, and are only restricted to immediate family members. Weddings, social congregations, and are hereby discouraged until further notice.
Kwa upande wake, kamishna wa kaunti hiyo aliwasihi kila mkazi wa kaunti hiyo kutilia maanani usafi na kuhakikisha kwamba watadumisha usalama katika ziwa Victoria na visiwa mbalimbali ili kuepuka virusi vya corona katika kaunti hiyo.
I would start by saying that we have also done a lot of sensitization on the beach management committees. Beach management committees are actually the people managing those islands. And even the same people we are using to help us on surveillance on the foreigners and aliens coming to the country. And the issue of the facilities, maybe Professor Muga can tell us something about Sena and Remba already have facilities. Yeah, so I think that is taken care of. We are going to enforce these directives. Our chiefs and assistant chiefs, the DCCs, the entire security team in the county will enforce these directives. But the most important thing is each and every one of us to take responsibility and be responsible. We should not be chasing one another on an issue that is touching each and every one of us.
Right.
So I would urge the members of the public to cooperate and adhere to these directives so that we are able to save our lives and manage the situation.
Kwa sasa, serikali ya kitaifa inaendelea kutilia mkazo wa Kenya kuwa safi kila wakati, huku shule, makanisa yakisitisha shughuli zao.
Universities and tertiary institutions are to close by Friday, 20th March 2020.
Kwa upande mwingine, baadhi ya mashirika yanaendelea kushinikiza wafanyakazi kufanyia shughuli nyumbani. Idadi ya waasiriwa wa virusi vya corona kwa sasa imefikia 7 kulingana na Waziri wa Afya Mutahi Kagwe. Paul Kirobi, Runinga ya TV47.
Na sasa tukielekea katika kaunti ya Uasin Gishu, wakazi mjini Eldoret wameitaka serikali kuweka mikakati kabambe ya kuwakamata na kuwachukulia hatua za dharura watu wanaoeneza jumbe za uongo na kupotosha kwenye mitandao za kijamii kuhusu ugonjwa wa corona. Wakati huo huo, udadisi umebaini kudorora kwa biashara mjini humo kutokana na idadi ndogo ya wanaofika mjini kutokana na hofu ya maambukizi ya corona. Kwa sasa tunaungana na mwanahabari wetu wa Eldoret Calvin Chitwa atujuze jinsi hali ilivyo.
Naam, kutoka kaunti ya Uasin Gishu kwa sasa vituo 120 vimetengwa spesheli iwapo virusi hivi vitaweza kushuhudiwa katika kaunti hii, na vituo hivyo vinajumuisha vile vya hospitali za kibinafsi, hospitali ya rufaa ya mafunzo ya Moi pamoja na zile za kaunti ya Uasin Gishu. Na kwa sasa katikati mwa mji kile ambacho kinaweza kushuhudiwa iwapo piga picha wangu wataweza kupiga picha kuweza kuonyesha biashara imeweza kuathirika katika maeneo haya. Wale ambao ni wafanya biashara katika mji huu kwa sasa hawashuhudii idadi ya wateja jinsi ilivyokuwa hapo awali. Kwa sasa jinsi mtazamaji unavyoona ni kwamba hali siyo kawaida jinsi ilivyokuwa hapo awali, na tutaweza kuzungumza tu na baadhi yao waweze kutuelezea hali iko vipi, na je, wateja wanakuja jinsi ilivyokuwa hapo awali? Je, unaweza zungumza biashara iko vipi kwa wakati huu?
Biashara iko chini pande yetu, wateja wamepotea, kazi iko chini, yani hivyo tu.
Serikali tusaidie. Jumambo ya biashara saizi imeharibika. Ukiangalia hata kwa saizi hakuna wateja wenye wananunua. Kila mtu anasema saizi wanashughulika vile watajua watajikinga na maradhi ya corona. Nasema ni lazima tulipe nyumba na hakuna kazi.
Naam, hilo tu ni ombi la wale ambao wanafanya biashara katika maeneo haya, wakisema kwamba kila ambacho serikali inaweza kuwasaidia ni kuhakikisha kwamba kodi ambayo huwa wanalipa hailipwi kama kawaida. Na kwa sasa pia kuna wale ambao wanasema kumekuwa na jumbe ambazo za kutatanisha na pia sio za kweli kuhusu virusi hivi vya corona, na tutaweza kuzungumza na mmoja wao aweze kutuelezea labda wazo lake kuhusu swala hili ni lipi.
Mimi naitwa Kenda God Silvan. Hii mambo ya corona imesidi, special wale ambayo wanaongea kwa social media, wanaeneza propaganda. Mimi kwa uwezo wangu ama kwa upande wangu, mimi ninaamini wale wa TV ambaye kama ni minister ambaye ametangaza mambo ya corona kwa TV ndio ninaamini, lakini kwa social media tujiadhari. Na ninataka niseme ya kwamba kwa counties special, mimi nimepoteza my grandmother today, na nimesikia kwamba within 24 hours watu wameshachukua mili zao. Lakini naomba pia serikali kwa wale ambao wamepoteza watu wao, kwa wale ambao wamepoteza watu wao wasaidie, kwa sababu to say the truth, nimeweza lost my grandmother this morning, na sasa kama ni 24 hours serikali watafanya nini? Na sio mimi peke yangu, hata wale wengine kwa kaunti zingine. Kama mimi nimetoka kaunti ya Baringo, na ninaomba serikali wasaidie wale ambao wameweza kuathirika kwa shida kama hilo. Otherwise serikali wachukulia hatua kwa wale ambao wanaeneza mambo ya social media, kama ni Facebook, wa deal with them thoroughly. Asante sana.
Asante. Naam, katika vinyozi pia kile ambacho tunashuhudia kwamba ni idadi ya wateja hapa. Unaona kama unavyotazama idadi ya mteja ambaye yako pale ni mmoja. Na kwa sasa tutazungumza tu na mfanya biashara mmoja wa mwisho aweze kutuelezea hali ya biashara hapa. Unashuhudia vipi hali yako?
Naam, hali ya biashara imerudi chini kulingana na hii corona. Sasa tunashangaa serikali itafute mikakati itatibidhi ndio biashara. Ukiangalia huku iko very scattered, hakuna kibiashara inaendelea. Tumetulia tu kwa duka na wenye nyumba wanangoja kodi yao, hataki kujua biashara iko waje. Sasa tungeomba serikali itafute mikakati angalau biashara iweze kunawiri. Haya, shukuru.
Na hali ni hiyo kutoka kaunti hii ya Uasin Gishu, na kila ambacho wanasisitiza ni kwamba serikali iweze kuangalia ni vipi wafanyabiashara watakumbukwa kuhusu kodi ambayo wanalipa, na vile vile wale ambao wanaeneza ujumbe wa uongo kuhusu janga hili ama ugonjwa huu wa corona waweze kuchukuliwa hatua. Kutoka kaunti ya Uasin Gishu, mimi ni Calvin Chitwa.
Asante sana Chitwa kwa taarifa hiyo. Wahudumu wa matatu wameagizwa kutotumia pesa taslimu kama njia ya malipo na badala yake kutumia njia mbadala ya kutumiwa pesa kwa njia ya simu. Kulingana na Katibu Mkuu wa Nyumba na Maendeleo ya Makazi Charles Hinga, agizo hilo linanuia kuzuia kusambaa kwa virusi hivyo. Akihutubia wanahabari, Hinga aliongeza kuwa abiria pia wameagizwa kuvaa nguo zinazofunika mikono yao ili kupunguza ngozi kushikana wakati wanapoabiri magari ya umma, huku abiria pia wakifanyiwa ukaguzi katika vituo vya mabasi kabla ya kuabiri magari hayo.
Department of Housing and Urban Development under the Ministry of Transport, Infrastructure, Housing, Urban Development and Public Works is in the process of implementing a multimodal public transportation strategy that incorporates the extensive commuter rail network with an improved bus rapid corridor network on 5 major links cordoning the city with dedicated bus lanes. As you are all aware, NAMATA is charged with the coordination and implementation of these aims for the Nairobi Metropolitan Transport, which covers the counties of Nairobi City, Kiambu, Kajiado, Machakos, and Murang'a. Being aware that there are in excess of 2 million journeys every day into Nairobi City, with half of the journeys being undertaken using public transport, we have gathered here to demonstrate our solidarity to advocate for a radical behavior transformation that will resonate with His Excellency, our President's call to curb the spread of COVID-19, otherwise popularly known as coronavirus. We recognize the great work that has been done by the National Emergency Response Committee on Coronavirus and related government, ministries, department, and the multi-agency team on informing and counseling the public on the recommended approach to promote prevention and the directives that have been issued to limit the spread of COVID-19. We also recognize the efforts by the Federation of Public Transport Sector, otherwise known as FPTS, in quickly putting in measures to actualize directives relating to public transport, including the directive to limit congestion in public transportation where possible.
Kufuatia ongezeko la visa vya maambukizi ya korona nchini, wananchi wameshauriwa kujitenga manyumbani mwao ili kuepukana na maambukizi. Daktari Samrat alielezea umuhimu wa kujitenga katika wakati huu.
Self-quarantine and isolation is something which everyone should start taking it very seriously. Because we are in stage 2 of pandemic. There are 4 stages of corona pandemic. Stage 1 is when the disease is imported from some other country. He is not the working national of this country. He comes from outside country and he is having that infection because he traveled to that country. Stage 2 is when that person starts giving infection to a small group of community, like say 40-50 people around him. So that is stage 2, wherein people around him are infected. Stage 3 is when the local transmission starts in the disease. You can see when disease started in China, or we talk about Italy, the number was single digit in first week. The number went to 3 digit in 2 weeks. By the end of 4 weeks, the number went to 5 digit. It's because of the local transmission. So right now we are in stage 2. So we are going to end up in stage 3 very soon. In order to prevent us from entering from stage 2 to stage 3, in order to avoid local transmission of the disease, we need to start doing self-quarantine or something called as isolation. Now what does self-quarantine or isolation mean? Anybody who is having cough or fever or breathing difficulty, no matter whether you are exposed to a person who is coming from corona affected country or no matter whether you traveled outside country, you should be isolated. Now it is a pandemic disease. You cannot sit and tell that I have not been in contact with anyone who had corona. I have not been in any country where there is corona, because you never know. Corona is already in the country.
Asante sana kwa usemi huo, lakini sasa ni wakati wa mapumziko. Tarejea na taarifa zingine. Asante sana kwa kutazama Shina La Upeo, na kwa sasa tunaenda moja kwa moja katika katika afisi za Wizara ya Afya, pale ambapo Waziri wa Afya Mutahi Kagwe anaongea. Na sasa hebu tusikize mambo yalivyo kule.
Lightly, there are those people, skeptics, who continue to pour doubt as to the seriousness of our situation. I urge you to continue, as members of the Fourth Estate, I urge you to continue to educate and affirm that this situation is real. It cannot be unreal in Kenya when it is real in China, it is real in the United States, in Spain, in Italy, and we think that in Kenya it is something to joke around with. It is not. It is not. And sometimes one is baffled by some of the reaction that we are getting. Please, let's take this matter seriously. Secondly, we will embark on random screening in targeted areas for members of the public, commencing this Saturday, March 21st, 2020. The exercise, to be coordinated by the Ministry of Health, will also involve other stakeholders, such as the Red Cross and security personnel, among others. Thirdly, we are structuring the team that is dealing with combating this virus. The Public Service Commission has today approved the remaining Ebola champions who have now been incorporated to assist in the COVID-19 response interventions. Our public health team has also embarked on disinfection of various premises and locations in the Nairobi city. We are liaising with county governments to escalate the same in the rest of the country. At the same time, I'm appealing to Kenyans who have been advised to work from home by their respective institutions to do exactly that. This is not a holiday season. It is time to fight a deadly virus. By congregating in entertainment joints, bars and restaurants, we will beat the very purpose for which they were asked to work at home. And we will resort eventually to us taking action against the institutions that people are gathering in. As we said, we are seeking for citizen responsibility. And that's a pregnant term because it carries with it certain aspects of behavior that we must change, ladies and gentlemen. And therefore, if we have been asked to take our children home and to isolate our kids, it did not mean that we now start taking them to the shopping centers, we start taking them to markets, we start taking them to playgrounds and museums. That is not what the intention is. The intention is to create social distance. So even while we are at home, if we do not keep social distance, then we will be defeating the logic of why we are doing it in the first place. I am appealing to Kenyans, therefore, to observe the instructions that the government has given. Entertainment areas, entertainment joints have been advised to stick to very strictly, to stick to a number of things. Number one is levels of cleanliness, sanitation, and hand washing. That's one. Number two is to stick strictly to the hours that they are supposed to operate. Very strictly to the hours that they are supposed to operate. Any institution of entertainment that is operating a minute beyond the hours that they are supposed to operate will have their licenses withdrawn. Finally, I want to appeal to members of the public to desist, and I have said this almost in every meeting that we have had, almost in every press conference. We have appealed to people to desist from any form of misinformation. I think you are all alive to what that the social media has been abuzz with all sorts of rumors, including that we are locking down Nairobi, that we are sending people home, that we are doing this and we are doing the other. Things that have come from nowhere, that we are deploying the military. You know, these rumors must stop. They must stop. And I think that members of the press, I would appeal to you to make this very obvious and to highlight this matter. And the reason why it is so important for us to do so is because when you tell people in social media to stay away from a hospital or to stay away from an area because there are suspected cases there, and it is false, one day it will be the truth, and people will still think it is false. You all know the story. I don't know whether you do. You all know the story of the boy and the leopard. It's an African story. This is what is happening today. We have got people who are spreading malicious rumors, falsehoods within the internet, and I'm appealing to them to stop. But because we are aware that empty appeals will not work, we will proceed to arrest a number of them just to prove our point. And of course, since they will have something to report regarding coronavirus, we'll oblige them by taking them to Bagathi, where they can report the matter, because, you know, that's where the issues of coronavirus can be handled. So we'll pay, they can go and visit and give their reports there. I still want to appeal to Kenyans for them to remain calm and not to cause panic. In fact, it is persons in the social media who are causing concern and panic among citizens. And to say this, as long as we do what we are saying, if we are disciplined enough to follow what the government is saying, then we will contain this transmission. That is what has happened to the countries that have contained it. They have behaved very responsibly, and they have managed to avoid situations that could have been catastrophic. This is a challenge we have. We have no doubt that if we behave well, we will avoid the kind of scenarios that we are seeing in other countries. But if we do not adhere, and if we do not follow what the government is appealing to do, I can also tell you that the results will also show. Actions in this case, behavior in this case, has its consequences. As His Excellency the President assured you on the day that he spoke to the nation, we have been faced with many a crisis before. And even this one, we will face in a similar format, with fortitude, with calmness, with unity, with cooperation. I want to thank all those who are taking their own initiatives to ensure that we are all involved in the fight against this disease and this virus. The business community, the non-governmental organizations, you members of the press. I want to state that we are very grateful to to all those who are coming out to support our cause. I want to take this opportunity to appeal to members of the public to utilize the free number that we have set, and it is working. You can call the number 719, and when you are reporting a case, this is the number to call, and we are urging people to call them instead of calling individuals within the Ministry of Health. I want to stop there and take one or two questions, and this.
One question. What is the efficacy of these masks that people are using in town, and what would be the advice from the ministry, noting that from your statements since yesterday, you've been saying that you're having to learn so much from China, and we saw that that one, people are wearing so many masks as they were going out alone. What is the efficacy? And number two, are we looking at one question, please, of setting up temporary hospitals with regards to your announcement of screening starting this Saturday?
Okay, I will explain the second one and then ask Dr. Amoth to respond to the issue of masks. But even as he responds, let me also say this. Long before coronavirus was here, the Chinese were wearing masks. It is almost as you wear a tie, they wear a mask. You know, so, but I'll let him respond to that particular one. On the matter of whether we intend to create mobile hospitals, we are not there yet. We haven't gotten there yet. We have got sufficient quarantine facilities. As I said, we are working with KMTCs, and they are all over the country, and they have got a huge capacity to quarantine people if there was necessity of doing so. But at the moment, we are quite happy with the exercise of self-quarantining. We have also infused a mobile-based system where once you come to the airport, and you must sign the declaration form indicating your number and your physical location. But once we have your number, we are able to keep tabs with your number 24/7. I think it is good to know that your number, we will keep knowing where you are at all times. You know, so it is important to note that. But we have not yet gotten to the point where we are thinking about other measures. As you yourself have said, if it came down to it, yes. But right now, it's not necessary. Yes, let me let Dr. Amoth answer to the question of masks first.
Thank you, Waziri. Masks are important, and let me make this very clear to the media and the public that the use of masks is only for two particular indications. One, if you are unwell, to prevent you from passing the droplet to whoever is taking care of you, or two, if you are a healthcare worker who is taking care of somebody who is sick. Otherwise, use of masks gives you a false sense of security that then leads you, and because you are not used to wearing a mask every day because you are not a surgeon or a doctor, you end up in trying to adjust the mask, touching your face, your nose, or your eyes, which puts you at even a greater risk of transmission of COVID-19. And on top of that, if you are well otherwise, you are wasting a useful resource which is very hard to come by now. Please, let's keep the mask for those of us who are unwell and the healthcare workers so that it can serve its intended purpose. Thank you.
Namaswa?
Thanks, Mark, again. That information reached us yesterday through an informant who informed us of this gentleman who came from Lisbon on Sunday last week and has been all over. I think he was even chased from Windsor Hotel. Immediately, in conjunction with the security apparatus, we circulated his number, and eventually we caught up with the gentleman today at Serena Hotel, and we transferred him to the Mbagathi isolation unit for isolation and testing to confirm his status.
And I did say yesterday, Namaso, I did say that if, and I appeal to the members of the public to also help us with the policing, and you can see it is working, you know, and we are thankful to those members of the public who said that and who called us, and of course we will keep the gentleman, you know, in isolation by force. If you cannot do so voluntarily, then we will keep you in isolation by force. And it is not necessary. It is very irresponsible for a person to know that they could have been exposed, and then they start going around dancing clubs. Honestly, you know, and that's why we are telling members of the public, you know, let us not accept. Having said that, I also want to say that you should not take the law into your own hands. You are not, if you are not a policeman, if you are not a health official, do not take the law in your own hands. I have warned before against profiling and xenophobia. And we have heard of a situation in Kwale, of a situation in Kwale, where people even beat up somebody just thinking that they might have a coronavirus, not knowing that those who are beating the gentleman up might be the ones themselves with the virus. Because unless and until you have been tested, nobody knows whether you have it or you don't. So it is very unfair. It is not right for anybody to be treated as such. So let's balance it. If you are supposed to quarantine yourself, quarantine yourself. If you leave your quarantine facilities, we will know, especially going forward. We will know. And once we know, we have no choice but to quarantine you. But we are hoping people are going to behave reasonably. Finally. Yeah.
Yes.
Okay, as far as the testing kits are concerned, we continue to buy as necessary. As you know, it has been in the media that the philanthropist Jack Ma has sent us through CDC some 20,000 testing kits. But even locally, we have continued to purchase locally. We have not run out of testing kits so far. What was the second question again? What was your second question, sorry? Testing is free. Testing is free. Nobody is being charged. No. What we are doing is that every day there are people, we pick people up, like for example the gentleman that you have had. So some of them are the ones that we had even yesterday, some of them. We have got new ones today. So every day is a changing situation. As they come in, the ones we think we need testing, we test. Final.
The World Health Organization yesterday said it is worried that the numbers in Africa will not be the position.
Your name?
My name is Stephen Leton from Citizen TV. The World Health Organization yesterday questioned the number of positive cases in Africa, saying they could not meet the true reflection of testing capacity. Should Kenya worry about the numbers that Waziri you are giving them?
I don't think so. Not for Kenya. I can't speak for other countries. But I can tell you that for Kenya, we are confident about what we are talking about. You know, also, we must stop looking down upon ourselves. You know, we cannot be we cannot be called banana republics 50 years ago and still continue to be called banana republics. You know, they used to say we are going to be overwhelmed by the circumstances we are going to face. Maybe. You know, God is our protector. Maybe, maybe not. But it is also good to acknowledge that even the so-called able people are also totally overwhelmed. All right? So let's not always believe in what somebody out there. They've got a very dismissive attitude about what we are able to do. So let's not look down upon ourselves. Let's behave. If we behave, we will prove them wrong. Thank you.
Asante sana. Ni matamshi ya waziri wa afya akiweza kuelezea Wakenya kuhusiana na maradhi na maambukizi ya coronavirus. Na sasa nitakuachia katika mikono ya DJ Trey ambaye ako tayari hapa kwa studio na 47 kali.